So one of the things as Ask the PA that I talked about over 3 years ago was why everybody in the country needs to have health insurance. And so I'm going to give you an example right now about why health insurance is so important in the United States for every single individual. Let's take an example of your 12-year-old who has abdominal pain and ends up in the emergency room with an appendicitis. So we're going to talk about no health insurance versus health insurance. When you have no health insurance, the billing is based on something called usual and customary, and what that is based on a very high inflated price of what is astronomical compared to the health insurance discounts. So when you have health insurance, what happens is each insurance company negotiates with doctors and with essentially hospitals and vendors for a discounted rate for services. So if you have health insurance, what happens is you get that discounted rate instead of the usual and customary. So let's talk about this poor child that went into the hospital. So they go to the hospital, go to the emergency room, they see an emergency room doctor. Doctor orders blood work, doctor orders a CT scan, finds out that the child has appendicitis. Then they have to call a surgeon, they have to call a second surgeon in, they have to call the anesthesiologist, they have to do some preparation, and then we have to talk about where they're going to do the surgery. Well, the surgery is done in the hospital, as we know, or an outpatient surgery clinic, and you have costs associated with that. You have basically the surgical suite or the hospital costs, you have the staffing costs, you have all the costs associated with medications, you have, if there's an overnight cost for that, you have the imaging costs from the radiology department. So all of that adds up. So let's talk about what the bottom line is if you have health insurance versus not health insurance. So let's say you have a health insurance and you have a health savings account. It's a $10,000 deductible and you have nothing. So with no discount, surgeon's going to charge $6,000, the assistant's going to charge $4,000, the anesthesiologist is going to charge $5,000, and then the ER, OR, and miscellaneous is $17,000. This is actually probably below what the real costs are going to be. This is probably about 20–30% less than actually what would happen. Here you have your discount, and the insurance company has already negotiated with the hospital, the surgeons, and everything. So the surgeon's negotiated rate is $2,000, the assistant is $1,500, the anesthesiologist is $1,500, and all the rest is $3,000. Your bottom line cost, if you have health insurance, for this case is $8,000. Okay, it goes to your $10,000 deductible, but at least it's not $32,000, the usual customary. What bankrupts people in the country is this kind of pricing. Most people cannot afford to do this, and this is what causes us to have so many problems. That's why Ask the PA, I will continue to say forever that we all need to have some form of health insurance in this country. Anyway, that's my solution, is think about it. Health insurance versus no health insurance. Bottom line, $8,000, your child is perfect versus $32,000. Have a good day.